Serva Health is the industry's leading provider of clinical call center and healthcare communications technology. With its nurse-staffed and enterprise-level call center technology, Serva Health can deliver relationship-focused services for your patients and caregivers. When a patient calls in to our nurses, our technology makes sure they have the best possible chance of reaching a nurse they've already had an interaction with. Our goal is to develop relationships with your patients and provide them with the best service possible. There is nothing more important to Serva Health than the patient.
Hello, I have some questions about this medication that I'm taking.
Whether we help the patient or caregiver by answering questions or reducing barriers to access, the patient is at the center of everything we do, from technology to staffing. With all of North America as our recruiting radius, we can find the best possible fit for your program in the shortest amount of time. We can staff to your specific requirements, including education, experience, certifications, or language fluency. Our distributed clinical call centers have the advantage of being much less vulnerable to natural disasters or outages. If a hurricane is bearing down on the East Coast, we simply transition our staffing to our West Coast nurses and servers. Serva Health also offers an innovative operating and staffing model where you only pay for dedicated nurses that can be fully utilized. The rest of the capacity requirements are staffed with variable nurses where you pay by the minute. This hybrid staffing model means that you never pay for excess capacity. Using Serva Health's virtual clinical call center, nurses are able to work from a validated home environment. Having nurses work from their home also allows for more flexible shift scheduling. Without the need for staff to commute to a call center, we can schedule nurses in one-hour shifts. This allows us to contour staffing precisely to the demand profile of your program. With the absence of a commute and with a sufficient number of trained variable nurses, we are able to react quickly to unexpected volume spikes. When a spike occurs, automated messages go out to all the nurses, and they're taking calls within minutes. When a patient dials the toll-free number, it automatically routes to that patient's nurse based on the patient's caller ID. If that nurse is not available, we'll either route to a designated backup nurse or to any other nurse that has assisted that patient previously. All of this happens instantaneously. Once the call is routed to a nurse, the patient's information is automatically loaded onto the screen so that the nurse has immediate access to it. The call was routed to the patient's nurse immediately, thanks to Retain ACD's advanced routing capabilities. The nurse has a full 360-degree view of the patient's status and history, thanks to Retain 3D's ability to be integrated with specialty pharmacies and other systems. And because Retain 3D is customized for your patient support program, everything the nurse needs is at their fingertips. The result? A white-glove, relationship-based patient experience that is truly helpful for them.
Is that a problem?
I'm not sure. I'll ask my supervisor.
If the nurse needs help from the project-specific clinical operations leader, the expert specialist for your program, help is just a click away. Similar to how the nurse has a 360-degree view of the patient, the clinical operations leader has a 360-degree view of all the nurses in the program. These features allow the clinical operations leader to provide instantaneous support when a nurse has a question during a call. This real-time support capability, built into the clinical operations leader's program-specific Retain ACD portal, enables nurses to get the patient all the support they need while they're still on the phone. No escalation, no transfer, no calling the patient back, just a world-class patient experience. The clinical operation leader also has robust live telemetry at their fingertips. Statistics like how many calls have come in, how many have been answered, how many are live, what the average wait time is, and other important information is always available to them. If a call has been in the queue too long, the screen changes color to alert the clinical operations leader to ensure that patient calls are answered in a timely manner. They can also see each nurse's historical and current status. This means they can see who's available for a call, who's on break, and who's unavailable. For any nurse that is on a call, the clinical operations leader can easily chat with them, discreetly listen in on the call, and monitor the nurse's computer screen.
Do you have any other concerns?
No, thank you. Bye.
Serva Health is dedicated to providing the highest quality patient support solutions and services at the best possible value through relationship-focused patient interactions, an innovative staffing and operations model, and industry-leading technologies. Because, in the end, serving patients are at the center of everything we do. For more information, visit us at www.servahealth.com.